So let's look at the 4 styles designed to address foot type and biomechanics in our foot function range. These include the Pronation, Supination, Propulsion and Neutral styles. For in-depth details on each style and case studies, we offer a free online training course, YouTube channel videos and product manual. The Pronation is one of the most popular styles in the range, as the mild to moderately pronated foot with an everted calcaneus, reduced MLA height and primary ankle equinus commonly presents to clinics with a range of symptomatic pathologies. The Pronation was designed to provide medial orthotic reaction force for the pronated flat foot, pediatric flat foot, or adult acquired flat foot. Key features include medial rear foot control. The Rearfoot platform provides the stability for transition from heel strike to mid-stance, with a medial wedge for increased medial orthotic force. The medial arch support provides support for the medial arch for transition from mid-stance to propulsion. It improves the windlass activation, improves forefoot stability, and promotes high gear toe-off. The lateral arch support stabilizes the foot and promotes the transition from heel strike to toe-off. The mild heel raise improves sagittal plane transition from mid-stance to propulsion and addresses any primary ankle equinus. The full-length performance EVA shell provides the combination of cushioning and control needed by this foot, and the luxury Rearfoot top cover is designed for both daily and sporting activities. The Supination has been the unlikely hero of our 9 styles, receiving the most positive feedback as it solves a real clinical problem. Despite being designed for a more uncommon foot type presentation to most clinics, the OTC options on the market to help the supinated or pes cavus foot are limited, while the tissue stress and pathologies patients present with are often some of the more painful. This orthotic is designed to provide the cushioning, contour and lateral support the supinated foot needs, and the most common pathologies associated with it. Key features include stable rear foot control. The Rearfoot platform provides stability for the transition from heel strike to mid-stance during foot loading. The medial arch cushioning and contour provides improved shock absorption and contour to the higher medial arch, increasing the surface contact area. The lateral arch support stabilizes the foot and promotes medial transition into propulsion. The lateral wedge improves lateral stability and medial transition into propulsion. The moderate heel raise improves transition from mid-stance to propulsion and addresses the common sagittal plane characteristics, including an ankle or a forefoot equinus. The propulsion is focused on the facilitation of sagittal plane function at the ankle and forefoot through the gait cycle and into propulsion. Often identified by clinicians in their clinical examination, including ankle range of motion and lunge test, and first MPJ range of motion and JAX test, and in their gait analysis, an ankle equinus or functional hallux limitus are pathology risk factors and can be addressed with orthotic prescription. The propulsion is designed for the foot showing signs and symptoms of impaired sagittal plane function at the ankle and or first MPJ. Key features include stable rear foot control. The Rearfoot platform provides stability for the transition from heel strike to mid-stance during foot loading. The medial arch support provides support for the medial arch for transition from mid-stance into propulsion, improves the windlass activation, forefoot stability, and promotes a high gear toe-off. The lateral arch support stabilizes the foot and promotes the transition from heel strike to toe-off. The moderate heel raise improves sagittal plane transition from mid-stance to propulsion and addresses any ankle equinus. A reverse Morton's extension improves propulsion, activation of the windlass mechanism, and sagittal plane function of the foot. The full-length performance EVA shell provides the combination of cushioning and control needed by this foot, and the luxury Rearfoot top cover is designed for both daily and sporting activities. The neutral foot, despite being within normal limits on clinical assessment for foot posture, foot function, and clinical tests, can still present to your clinic with tissue stress pathology from occupational demands, sports, poor footwear, or an underlying disease process. The characteristics of the DOLA Pro orthotic shell is often all that is required to help this patient. The neutral Patient Ready Orthotic comes pre-covered, fully reinforced and ready to go direct from the packet. Now let's look at the 5 styles in the Patient Ready range designed to address tissue stress, pathology and complex at-risk feet, including the Rearfoot, Forefoot, Medial, Lateral and Sensitive styles. The Forefoot is one of the most popular styles for females in occupations requiring long hours standing, including nursing, teaching and retail. It is designed with features to address first MPJ function and help with common foot pathologies, including neuroma, plantar plate pain and metatarsalgia. The Forefoot includes the standard features of the DOLA Pro full length plus a pour-on metatarsal bar. The material attributes and positioning provides cushioning and support to reduce the overload on the forefoot during gait. The Rearfoot is a popular clinical selection for both children and adults. It is designed for posterior pathomechanics, including Achilles pathology, severs or calcaneal-apophysitis, gastroc or soleus injury, and impaired sagittal plane function at the ankle. The Rearfoot includes the standard features of the DOLA Pro full length plus a moderate heel raise. This increase in stiffness coefficient in the heel reduces the load and tissue stress on the posterior structures and improves the sagittal plane facilitation from loading into propulsion. The Medial is designed to help patients with common medial foot and leg pathologies, including plantar heel pain. Plantar fasciitis, plantar fascia pathology, and plantar heel pain presentations can benefit from the features of this orthotic. The Medial includes the full features of the DOLA Pro full length, plus a pour-on heel cushion. This increases the cushioning and comfort of the plantar heel, combined with the medial arch support to improve the transition from mid-stance to propulsion, improve windlass activation, forefoot stability, and high gear toe-off. This aims to reduce the load on medial structures of the foot and ankle. The Lateral has been one of the most popular pathology styles in the Patient Ready range. Like the supinated model, feedback from clinicians is it solves a real clinical problem not addressed in the current OTC market, for a design focusing on reducing the tissue stress and load on the lateral foot and ankle. It is designed to assist with the treatment of peroneal pathologies, cuboid syndrome, lateral foot pain, and lateral ankle and forefoot instability. The Lateral includes the full features of the DOLA Pro full length, plus lateral arch cushioning and contour with a pour-on lateral arch pad. This stabilizes the lateral foot and promotes medial transition into propulsion. A moderate heel raise. The increased stiffness coefficient of the heel raise reduces tissue stress on the posterior structures and improves sagittal plane transition. Lateral EVA wedge. This improves lateral stability and promotes a medial transition into propulsion for high gear toe-off. The final model in the pathology range focuses on helping patients who present with complex medical history and risk factors for foot complications including ulceration, pathomechanics for arthritis, and skin changes including hyperkeratosis and fat pad atrophy. The specialty top cover selection and design of the DOLA Pro full-length orthotic can help these patients maintain mobility, reduce risk or complications, and is a perfect addition to a general podiatric treatment plan. Stable rear foot control. The Rearfoot platform provides stability for the transition from heel strike to mid-stance, helping with balance and the forward COP progression. The medial arch support provides support for the medial arch for transition from mid-stance into propulsion, improves the windlass activation, forefoot stability, and promotes a high gear toe-off, and increases the plantar contact area for plantar pressure distribution and balance. Lateral arch support. This stabilizes the foot and aids in transition from heel strike to toe-off. A mild heel raise improves sagittal plane transition from mid-stance to propulsion and addresses any ankle equinus. The full-length performance EVA shell provides the combination of cushioning and control needed by this foot, and the highly cushioned top cover with anti-shear technology reduces plantar tissue stress, and reduces the risk in the at-risk foot. As previously mentioned, we have a wide range of education and training to support the use of the Patient Ready Orthotic range, including a manual, online training course, and videos on our YouTube channel, including expanded product information and case studies. Follow these links for more information. Welcome to our DOLA Patient Ready Orthotic online training course, helping practitioners add the missing piece to their current in-clinic treatment and management services. Build orthotic confidence with our support. DOLA Orthotics is an Australian-based orthotic and medical technology company that has been providing orthotic services to health professionals worldwide for over 20 years. During this time, we have developed a range of orthotics to fix the feet that walk into your clinic every day. In this course, we'll be covering many topics, including how to select the best orthotic for your patient from our range. Who can you help with patient-ready orthotics, including patients with different foot types or pathomechanical function, different ages from children to adults, and different activity levels from sports to occupational. What can you help with patient-ready orthotics, including the most common pathologies and symptoms that keep presenting to your clinic every day? Confidence that you can help with patient-ready orthotics. The results of many of your current management strategies can give you the confidence that an orthotic will be a great addition to your treatment options. Why will patient-ready orthotics help? Each of our orthotic range have features designed to help a combination of foot type or pathomechanical function. Benefit from our 50 years of orthotic experience and learn how you can use these features to help your patients. How DOLA Orthotics supports you as a practitioner. Learn how to use with our case study test fit series. See how the Patient Ready Orthotic range is used in clinic with a series of case studies, showing you the thought process behind the style selection and practical fitting to the patient's shoes. On completion of the course, you'll receive a CPD certificate for self-directed learning and become a certified patient-ready orthotic practitioner. This qualifies you for special offers through our practitioner network. Here's an example of the Who You Can Help video for the Supination orthotic. The supinated foot is a complex presentation, often displaying a combination of pathomechanical function in the frontal, sagittal, and transverse planes. From the posterior view, this foot may present with the calcaneus trending from a vertical to an inverted position in the frontal plane, more convex malleolar curves, and toes visible more medially. From the medial view, the foot may present with a higher medial longitudinal arch, with the talar head palpable more laterally than medially. From the medial oblique view, the talar navicular region may appear more concave or hollow. Using plantar pressure analysis, this foot may present with a reduced plantar surface contact area and high heel and forefoot pressures. During sagittal plane function in gait, due to the more rigid foot structure and the lack of rear foot eversion, the supinated foot may present with poor shock absorption, leading to compensation in the proximal chain at the ankle, knee, and hip. Another common presentation of this foot type is a sagittal plane block at the ankle or an ankle equinus, which is a decreased range of motion due to tightening of the posterior structures, including the gastrocnemius or soleus. During foot loading from heel strike to mid-stance, the foot may also present with lateral instability as seen by overactive perineals, prolonged loading of the lateral foot, and maintenance of a lateral toe-off pattern. The lateral toe-off pattern, or low gear toe-off pattern, is a sign of impaired propulsion and may also result in proximal compensations. On examination of the forefoot, the supinated foot can also present with several features. They include an adducted forefoot, a forefoot valgus, a plantarflex first metatarsal, or a forefoot equinus. A supinated foot can also present with many mistimed gait events. They can include the previously mentioned poor shock absorption, prolonged lateral loading, a low gear or lateral toe off, and impaired propulsion and windlass mechanism. Your patient may present to your clinic with many pathologies relating to their foot posture and function, including various forefoot pathologies, including skin changes or hyperkeratosis, general metatarsalgia, metatarsal capsulitis, bursitis, neuritis, or neuroma, all relating to the high loading and high forefoot pressures and impaired forefoot function, especially during propulsion or toe-off. First MPJ pathologies are also common, including bunions or HAV, and the development of hallux limitus and sesamoiditis, all relating to forefoot loading, function, and instability. Toe deformities may also be a sign of impaired forefoot function, including plantar plate injury, claw toes, or retracted toes due to muscular imbalance. Arch and heel presentations are also common, including plantar heel pain, plantar fasciitis, Achilles pathologies, fat pad syndrome, and midfoot osteoarthritis, all relating to the foot loading and increased tissue stress demands. The lateral foot loading, lateral toe off, and instability can all be related to presenting complaints including perineal pathologies, lateral foot pain, cuboid syndrome, and lateral ankle instability. Due to the proximal chain compensations previously mentioned and poor shock absorption, your patient may also present with common pathologies affecting the patella or patellofemoral joint, the knee joint, sacroiliac joint, and lower back. The signs may already be there in your current treatments, giving you confidence that the supination orthotic will help your patient. Have you had success with taping of the medial arch, lateral ankle or forefoot? A footwear change to a more cushioned style, stretching or strengthening program, improved capacity of the pathological tissue or treatment-directed testing of a lateral wedge, medial arch pad, lateral arch pad or heel raise? Or has your patient had previous insoles? All of these may indicate that the patient-ready supination orthotic will be a successful option. So how does the patient-ready supination orthotic help my patient? This orthotic design combines the cushioning, contour, and lateral support the supinated foot needs. Here's an example of a case study from a real-life patient for the Propulsion orthotic. Case Study Test Fit Series. Patient Presentation. Our patient is a 40-year-old male with symptomatic Achilles tendinopathy and mild first MPJ pain during daily walks, weekly tennis, and social golf. He has no significant medical history or underlying disease condition and wants to maintain activity for general health and weight management. He is mildly pronated in stance and gait, with mild rear foot eversion within the subtalar joint range of motion, and without a significant reduction in medial arch profile. His main pathomechanics link to sagittal plane function at the ankle and first MPJ. He has a primary ankle equinus, or reduced ankle range of motion, both on non-weight bearing assessment and on functional assessment. He also has functional hallux limitus, with low range and high force results on Jack's test compared to non-weight bearing assessment. We plan to include a patient-ready orthotic in his treatment plan from the 9 options available. Confidence it will help. The patient responded positively to treatment-directed testing of low-dye strapping with first-ray plantar flexion and heel raises in his work and sports shoes. He is completing a tendon rehabilitation program to improve the functional capacity of the tissue as well as other in-clinic treatment protocols. The patient has appropriate selection of shoes for his weekly activities that are orthotic friendly with removable insoles. Why will it help? Based on the key points of the patient assessment and treatment-directed testing, we selected the Propulsion Patient Ready Orthotic for this patient. The Propulsion Patient Ready Orthotic was fitted to the patient's footwear following the fitting guide, including to his Asics Noosa Tris for his daily walks, Asics Court FF2s for weekly tennis, Echo Biome H4 for golf, and Echo Business shoes for work. The 9 patient-specific styles just outlined give you as the clinician more options to patient match the orthotic based on the history, examination, and assessment of your patients. Test fitting coming up next during the appointment can also ensure footwear fit and patient happiness, while often ordering custom orthotics involves the unknown. Designed for instant dispense when kept in stock or fast ordering and refill from our partners, including Canonbury Healthcare and Briggate, your patients will get results even faster. We value the time invested in your training and the expertise of health professionals in orthotic prescription and selection. Therefore, all of our products are only ever supplied to health professionals only. We recommend keeping a size range in stock for test fitting. If you don't have the style of Patient Ready Orthotic in stock, no problem. Simply test fit another style and order the size and style you need. Our partners, including Canonbury Healthcare and Briggate Medical, keep stock for quick order fulfillment. Give your patients some padding or strapping and exercises, and their orthotic will be there in a few days, ready for dispense. How to fit. Fitting the patient-ready orthotics to your patient's shoes in clinic is fast and easy following these 5 steps. Step 1. Remove the original insole or liner from the patient's shoes. Step 2. Place the original insole on top of the patient-ready orthotics, lining them up at the heel. Step 3. Using a pen or marker, trace around the front of the original insole, leaving a mark on the patient-ready orthotic. Step 4. Trim the front of the patient-ready orthotic by following the pen marking. Step 5. Insert the patient-ready orthotic into your patient's shoes and dispense.
So while the 9 patient-ready orthotic styles are designed